clinical medical assistant questions and answers 180 multiple choice questions. Question 1. A medical assistant is caring for a patient who has insulin shock caused by severe hypoglycemia. The assistant should identify that which of the following medications is used to treat this condition. Here are the options. Option A, insulin. Option B, glucose. Option C, furosemide. Option D, haloperidol. The correct answer is option B, glucose. Glucose is correct because severe hypoglycemia requires rapidly raising the blood glucose level. Insulin would lower it further. Question 2. When complying with standard precautions, which of the following is an appropriate action for a medical assistant to take? Here are the options. Option A, using disposable gloves while obtaining vitals. Option B, wearing a gown while shaving a patient for an EKG. Option C, using a 10% glutaraldehyde solution for hand asepsis. Option D, wearing goggles when processing blood specimens. The correct answer is option A, using disposable gloves while obtaining vitals. Using disposable gloves while obtaining vitals is correct because gloves are part of standard precautions when there is possible contact with blood or body fluids. Question 3. Which of the following office protocols meets OSHA regulations and standards? Here are the options. Option A, employees must submit to a hepatitis B immunization upon employment. Option B, medical records of employees who were exposed to occupational hazards are destroyed after 1 year. Option C, training in new safety engineered control devices is conducted annually. Option D, employees are mandated to provide and maintain their own personal protective equipment. The correct answer is option C. Training in new safety engineered control devices is conducted annually. Training in new safety engineered control devices is conducted annually is correct because OSHA requires ongoing safety measures, training, and exposure control practices for workplace hazards. Question 4. Which of the following actions should a medical assistant take when performing a capillary puncture? Here are the options. Option A, wipe away the first 5 drops of blood after puncturing. Option B, apply even pressure to the finger during the collection. Option C, puncture the index finger at the tip. Option D, puncture parallel to the fingerprint. The correct answer is option D, puncture parallel to the fingerprint. Puncture parallel to the fingerprint is correct because capillary puncture should use an appropriate site and technique to obtain blood safely and accurately. Question 5. Which of the following guidelines applies to sending orders for Schedule Roman II prescriptions? Here are the options. Option A, telephone orders are permitted. Option B, orders can be refilled. Option C, orders can either be written or an e-prescription. Option D, a provider's signature is not required. The correct answer is option C. Orders can either be written or an e-prescription.
Orders can either be written or an e-prescription is correct because Schedule Roman II prescriptions generally require written or compliant electronic orders and do not allow routine refills. Question 6.
Which of the following factors increases the risk of developing Crohn's disease? Here are the options. Option A, advanced age. Option B, residence in a rural area. Option C, family history. Option D,
Hispanic ethnicity. The correct answer is option C,
family history. Family history is correct because a family history increases the risk of developing Crohn's disease.
Question 7.
A medical assistant is performing a venipuncture on an older adult patient who has partial thickness burns and scar tissue on the right arm in the antecubital space, as well as a full arm cast on the left arm. Which of the following sites should the assistant select for the venipuncture? Here are the options. Option A, left basilic vein. Option B, right dorsal vein. Option C, left cephalic vein. Option D, right femoral vein.
The correct answer is option B,
right dorsal vein. Right dorsal vein is correct because venipuncture should avoid burned, scarred, or casted areas and use the best available accessible vein.
Question 8.
A medical assistant has assisted the provider in completing a cyst removal in office.
Before the patient is released, which of the following documents should the assistant give to the patient?
Here are the options. Option A,
post-procedural instructions.
Option B, informed consent document. Option C, pathology requisition form. Option D, itemized surgical bill.
The correct answer is option A, post-procedural instructions.
Post-procedural instructions is correct because patients need clear instructions for safe care before or after a procedure.
Question 9. Which of the following areas of the body should a medical assistant use to obtain a patient's temperature using a temporal artery thermometer?
Here are the options. Option A, tympanic membrane. Option B, armpit. Option C,
rectum.
Option D,
forehead. The correct answer is option D, forehead.
Forehead is correct because temporal artery temperature is obtained by scanning the forehead area.
Question 10.
A patient reports sweating, flushed extremities, ringing in his ears, and dizziness during his last blood draw. Which of the following should the medical assistant recognize as the greatest risk for the patient while performing a venipuncture? Here are the options. Option A,
hematoma.
Option B,
neuropathy.
Option C,
neuritis.
Option D,
syncope. The correct answer is option D, syncope.
Syncope is correct because dizziness, sweating, and ringing in the ears during blood collection can precede fainting.
Question 11.
Which of the following is a chronic complication of diabetes mellitus? Here are the options. Option A, retinopathy. Option B, deafness. Option C,
renal calculi.
option D, acute appendicitis.
The correct answer is option A.
Retinopathy. Retinopathy is correct because it is directly related to diabetes monitoring or a serious complication that requires prompt attention.
Question 12. A decrease in blood calcium normally stimulates the release of which of the following?
Here are the options. Option A, thyroxine. Option B, luteinizing hormone. Option C, parathyroid hormone. Option D,
Oxytocin. The correct answer is option C.
parathyroid hormone.
Parathyroid hormone is correct because low blood calcium stimulates parathyroid hormone release to help raise calcium levels. Question 13. A medical assistant notes the abbreviation NS next to several appointments from the previous day's office schedule. Which of the following is the correct description of this abbreviation?
Here are the options. Option A, new surgical. Option B, normal scheduling. Option C,
Need supervision.
option D,
No-show. The correct answer is option D. No-show.
no-show is correct because NS commonly documents that the patient did not appear for the scheduled appointment.
Question 14. A medical assistant just placed a Holter monitor on a patient. Which of the following information should the assistant include in the teaching about the monitor?
Here are the options. Option A, the monitor records daily calorie intake. Option B, the monitor records emotional upsets. Option C, the monitor records menstruation cycle. Option D,
The monitor records usage of an underwire bra. The correct answer is option B.
the monitor records emotional upsets. The monitor records emotional upsets is correct because Holter monitoring records cardiac activity while the patient logs symptoms, activities, and events during the test.
Question 15. Which of the following actions should a medical assistant take when communicating with an older adult patient?
Here are the options. Option A, ask questions that require a simple yes or no answer. Option B,
Observe the patient's nonverbal cues indicating understanding.
Option C,
Interrupt the patient to ask for clarification.
Option D, use endearing terms such as honey or sweetie.
The correct answer is option B. Observe the patient's nonverbal cues indicating understanding. Observe the patient's nonverbal cues indicating understanding is correct because observing nonverbal cues helps confirm understanding without using patronizing language. Question 16.
A medical assistant is preparing the autoclave to sterilize instruments. Which of the following items is required to properly process the instruments? Here are the options. Option A, cotton balls. Option B, masking tape. Option C,
Tap water.
Option D, sterilization indicators.
The correct answer is option D.
Sterilization indicators. Sterilization indicators is correct because sterile technique requires indicators, proper field handling, and avoiding contamination.
Question 17.
A medical assistant should identify osteomalacia as which of the following? Here are the options. Option A, the inflammation of bone and cartilage due to infection. Option B, the enlargement of the extremities due to a metabolic syndrome. Option C, the fusing of the bones at the joints due to arthritic changes. Option D, the softening of the bone due to vitamin D deficiency.
The correct answer is option D.
The softening of the bone due to vitamin D deficiency. The softening of the bone due to vitamin D deficiency is correct because osteomalacia is softening of bone caused by inadequate vitamin D or defective mineralization.
Question 18.
When performing a venipuncture, how many inches above the site should the medical assistant place the tourniquet? Here are the options. Option A, 1. Option B, 2. Option C, 4. Option D, 5.
The correct answer is option B,
2. 2 is correct because a tourniquet is typically placed about 2 to 4 inches above the venipuncture site.
Question 19. Which of the following should a medical assistant obtain when a patient who has a managed care plan requires surgery?
Here are the options. Option A,
explanation of benefits.
Option B, prior authorization. Option C, fee for service. Option D,
gatekeeper approval. The correct answer is option B,
prior authorization. Prior authorization is correct because managed care and some procedures require insurer approval before the service is performed.
Question 20.
A medical assistant is checking a patient out at the reception desk after her scheduled appointment. Which of the following documents should the assistant check to confirm when the provider would like to have the patient return to the clinic? Here are the options. Option A,
encounter form.
Option B, diagnostic report. Option C, written prescription. Option D, laboratory requisition.
The correct answer is option A, encounter form.
Encounter form is correct because the encounter form documents the visit and provider instructions, including follow-up information.
Question 21.
A medical assistant is scheduling all patients who are having cyst removals to be seen on the first Thursday of the month. Which of the following types of scheduling is the assistant using? Here are the options. Option A,
waive.
Option B, open hours. Option C,
flexible hours.
Option D, grouping.
The correct answer is option D,
grouping. Grouping is correct because grouping schedules similar procedures together during a designated time block.
Question 22.
A patient is having a cardiac stress test and reports to the medical assistant that she is perspiring.
Which of the following actions should the assistant take?
Here are the options. Option A,
Notify the cardiologist.
Option B.
Contact the emergency department.
Option C. Continue the test without interruption. Option D. Document the perspiration.
The correct answer is option C.
Continue the test without interruption. Continue the test without interruption is correct because perspiration can be expected during exercise stress testing unless more serious symptoms occur.
Question 23. In the conduction system of the heart, which of the following components is stimulated after the sinoatrial node?
Here are the options. Option A.
Left bundle branch.
Option B. Purkinje fibers. Option C. Right bundle branch. Option D.
Atrioventricular node. The correct answer is option D.
Atrioventricular node. Atrioventricular node is correct because the impulse normally travels from the SA node to the AV node before moving through the ventricles.
Question 24.
A medical assistant is preparing to obtain a specimen from a patient for influenza testing.
Which of the following sites should the assistant use when collecting the specimen?
Here are the options. Option A. Sublingual. Option B.
Buccal.
Option C. Nasopharyngeal. Option D. Dermal.
The correct answer is option C.
Nasopharyngeal. Nasopharyngeal is correct because influenza specimens are commonly collected from the nasopharyngeal area.
Question 25.
A patient comes into a provider's office and reports intimate partner abuse. Which of the following actions should the medical assistant take to assist the patient? Here are the options. Option A.
Share personal experience with the patient.
Option B.
Refer the patient to another provider.
Option C. Provide a list of relevant community organizations. Option D.
Counsel the patient on the situation. The correct answer is option C.
Provide the list of relevant community organizations.
Provide a list of relevant community organizations is correct because the assistant can support the patient by connecting them with appropriate community resources. Question 26.
A medical assistant schedules 3 patients to arrive at the same time for each hour of the day, and each patient is seen in the order they arrive. Which scheduling style is the assistant using? Here are the options. Option A.
Wave.
Option B.
Double booking.
Option C.
Advance booking.
Option D. Grouping.
The correct answer is option A. Wave.
Wave is correct because wave scheduling assigns several patients to the same time period and sees them as they arrive. Question 27. A new parent inquires about mandatory immunizations for his child. To which of the following organizations should the medical assistant refer the parent? Here are the options. Option A. Centers for Medicare and Medicaid Services. Option B. World Health Organization. Option C. Centers for Disease Control. Option D.
American Red Cross. The correct answer is option C.
Centers for Disease Control. Centers for Disease Control is correct because the CDC publishes immunization recommendations and schedules.
Question 28.
Which of the following should a medical assistant use when sending out reminders to patients for their yearly appointment? Here are the options. Option A, a ledger card. Option B,
A tickler file.
Option C, a CMS 1500 form. Option D,
An audit trail. The correct answer is option B. A tickler file.
a tickler file is correct because a tickler file is used to track reminders and future follow-up items.
Question 29.
Giving the patient adequate information concerning the method, risk, and consequences prior to a procedure is called. Here are the options. Option A,
Confidentiality.
Option B, tort. Option C,
Informed consent.
Option D, the right to know.
The correct answer is option C.
Informed consent. Informed consent is correct because informed consent means the patient receives enough information about risks, benefits, and alternatives before agreeing.
Question 30.
A medical assistant is caring for a patient who expresses a desire to donate their organs for scientific study in the event of their death.
The assistant should provide the patient with information about which of the following documents.
Here are the options. Option A, Notice of Privacy Practices. Option B,
Informed consent.
Option C, Durable Power of Attorney. Option D, Living Will.
The correct answer is option D.
Living Will. Living will is correct because a living will records a patient's wishes for care or donation-related decisions if they cannot speak for themselves.
Question 31. Which of the following terms describes a microorganism's ability to grow in the absence of oxygen?
Here are the options. Option A,
Resistant.
Option B,
Acid fast.
Option C,
Anaerobic.
Option D,
Opportunistic. The correct answer is option C.
Anaerobic. Anaerobic is correct because anaerobic organisms can grow without oxygen.
Question 32.
A medical assistant is preparing a patient for an EKG.
What should the assistant do if the electrode's adhesives appear to be ineffective?
Here are the options. Option A, clean the skin with a cavicide wipe. Option B, clean the skin with conductive gel. Option C, attach the leads with cloth tape. Option D, attach the leads with butterfly closures.
The correct answer is option C.
Attach the leads with cloth tape.
Attach the leads with cloth tape is correct because tape can help secure electrodes when adhesion is poor while maintaining lead contact. Question 33.
A medical assistant is setting up a tray for a minor procedure. Which of the following actions maintains the sterile field of the tray? Here are the options. Option A, opens the package away from the body. Option B, keeps hands below the waist. Option C. Places instruments on the tray's border. Option D. Dons clean gloves.
The correct answer is option A.
Opens the package away from the body. Opens the package away from the body is correct because sterile technique requires indicators, proper field handling, and avoiding contamination.
Question 34.
Which of the following is a risk factor for the development of cirrhosis? Here are the options. Option A.
Celiac disease.
Option B.
Hypolipidemia.
Option C.
Hypoglycemia.
Option D.
Chronic alcohol use. The correct answer is option D.
Chronic alcohol use.
Chronic alcohol use is correct because chronic alcohol use is a major risk factor for cirrhosis.
Question 35. Contact dermatitis can result as a reaction to which of the following substances? Here are the options. Option A. Oral penicillin. Option B. Leech vapors. Option C.
Tetanus vaccination.
Option D.
Latex gloves. The correct answer is option D. Latex gloves.
Latex gloves is correct because latex can trigger a local skin reaction called contact dermatitis.
Question 36.
A medical assistant is preparing to measure a patient's range of motion. Which of the following devices should the assistants use? Here are the options. Option A.
Goniometer.
Option B. Transcutaneous electrical nerve simulation unit. Option C.
Sphygmomanometer.
Option D. Resistance bands.
The correct answer is option A.
Goniometer. Goniometer is correct because a goniometer measures joint angles and range of motion. Question 37. A medical assistant should take which of the following actions when removing sutures? Here are the options. Option A. Perform a sterile hand scrub. Option B. Lift the knot toward the wound. Option C. Begin cutting the sutures in the middle of the wound. Option D. Clean the wound with a disinfectant.
The correct answer is option D.
Clean the wound with a disinfectant. Clean the wound with a disinfectant is correct because the site should be cleansed before sutures are removed to reduce infection risk.
Question 38. Which of the following is a legal tort that involves deception with the intent to deprive another person of their rights?
Here are the options. Option A. Defamation. Option B.
Battery.
Option C.
Negligence.
Option D.
Fraud. The correct answer is option D. Fraud. Fraud is correct because fraud involves intentional deception for personal or financial gain. Question 39.
A medical assistant sustains a splash exposure to the eyes from a patient's body fluids. Which of the following is the proper length of time for her to flush her eyes at an eye wash station? Here are the options. Option A. 30 secs. Option B.
2 min.
Option C. 5 min. Option D, 15 min.
The correct answer is option D,
15 min. 15 min is correct because eye exposure to body fluids requires prolonged flushing at an eye wash station.
Question 40.
A medical assistant is assisting a provider with a cervical biopsy. Which of the following information is required on the specimen label? Here are the options. Option A,
blood type.
Option B, previous STD status. Option C, fasting status. Option D, site of sample.
The correct answer is option D,
site of sample. Site of sample is correct because specimen labels must identify the source or site so the laboratory can process it correctly.
Question 41.
A medical assistant is applying EKG electrodes to a patient who is sweating profusely and reports chest pain. Which of the following actions should the assistant take to acquire an adequate tracing? Here are the options. Option A, ensure the skin is clean and dry. Option B, apply conductive gel to the patient's chest. Option C,
shave the electrode sites.
Option D, place the electrodes below the clavicle.
The correct answer is option A,
ensure the skin is clean and dry. Ensure the skin is clean and dry is correct because clean, dry skin improves electrode adhesion and reduces artifact.
Question 42.
A medical assistant suspects that a pediatric patient is being abused. Which of the following actions is appropriate for the assistant to take? Here are the options. Option A,
question the parent.
Option B,
contact a school counselor.
Option C,
document the abuse.
Option D,
notify the provider. The correct answer is option D, notify the provider.
Notify the provider is correct because suspected child abuse must be escalated according to reporting policy and provider direction.
Question 43.
A patient's blood stains a medical assistant's uniform.
Which of the following should the medical assistant do first?
Here are the options. Option A, dispose of the uniform. Option B,
finish the procedure.
Option C,
clean the area.
Option D, report it to the supervisor.
The correct answer is option B, finish the procedure. Finish the procedure is correct because immediate patient safety comes first. Then the assistant should follow exposure and laundry procedures. Question 44. Proper aseptic technique includes which of the following?
Here are the options. Option A,
using an alcohol-based rub in place of hand washing.
Option B, recapping needles before disposal. Option C, recycling prefilled syringes. Option D, disposing of used tourniquets in a sharps container.
The correct answer is option A, using an alcohol-based rub in place of hand washing. Using an alcohol-based rub in place of hand washing is correct because alcohol-based rubs are acceptable hand hygiene when hands are not visibly soiled. Question 45.
A medical assistant is preparing to administer an eye solution for irrigation. After verifying the provider's prescription, which of the following actions should the assistant take next? Here are the options. Option A. Check the expiration date of the solution. Option B. Ensure the patient is in a seated position. Option C. Moisten a gauze square. Option D. Disinfect the patient's lower eyelid.
The correct answer is option A.
Check the expiration date of the solution. Check the expiration date of the solution is correct because medications and solutions must be checked for safety and expiration before use.
Question 46.
When completing a laboratory requisition form for a CBC, which of the following information should a medical assistant include? Here are the options. Option A.
Patient consent.
Option B.
Patient's initials.
Option C. Laboratory supervisor signature. Option D. Date and time of collection.
The correct answer is option D.
Date and time of collection. Date and time of collection is correct because the collection date and time are required to identify when the specimen was obtained. Question 47.
Which of the following techniques should a medical assistant use to provide support to the joint when applying a bandage to an ankle?
Here are the options. Option A.
Figure 8.
Option B.
Recurrent.
Option C.
Tubular.
Option D.
Triangular. The correct answer is option A.
Figure 8. Figure 8 is correct because a figure 8 wrap supports joints such as the ankle while allowing controlled movement.
Question 48. Which of the following is the current universal claim form submitted for outpatient medical billing?
Here are the options. Option A. CMS 1500. Option B. HCFA 1500. Option C. 1-9. Option D. Superbill.
The correct answer is option A.
CMS 1500.
CMS 1500 is correct because it is the standard professional claim form used for outpatient medical billing. Question 49.
Which of the following organizations should an employer consult to arrange blood-borne pathogen training for its employees? Here are the options. Option A.
AHAR.
Option B.
OSHA.
Option C.
Clear.
Option D.
DIDO. The correct answer is option B. OSHA.
OSHA is correct because OSHA requires ongoing safety measures, training, and exposure control practices for workplace hazards.
Question 50.
Which of the following tasks is the responsibility of a medical assistant when scheduling an outpatient surgical procedure? Here are the options. Option A.
Schedule the anesthesiologist for the surgery.
Option B. Review the risks and benefits of the surgery with the patient to obtain consent. Option C.
Instruct the patient to obtain an insurance pre-authorization prior to the surgery.
Option D. Provide the patient with specific preoperative directions.
The correct answer is option D.
Provide the patient with specific preoperative directions. Provide the patient with specific preoperative directions is correct because patients need clear instructions for safe care before or after a procedure.
Question 51.
A medical assistant is obtaining pregnancy test results for a 15-year-old patient. The test is negative. To whom should the assistant provide the results? Here are the options. Option A,
Patient's legal guardian.
Option B,
The patient.
Option C, Health Department. Option D, Medicaid.
The correct answer is option B.
The patient.
The patient is correct because the minor patient who received the test should receive her own result according to confidentiality practices. Question 52. Which of the following procedures should a medical assistant identify as a surgical reconstruction?
Here are the options. Option A,
Thoracentesis.
Option B, rhinoplasty. Option C, appendectomy. Option D,
Colotomy. The correct answer is option B.
rhinoplasty. Rhinoplasty is correct because rhinoplasty is reconstructive or cosmetic surgical repair of the nose.
Question 53.
A medical assistant is setting up a surgical tray for a procedure. What distance from the edges of the sterile field should the assistant consider contaminated? Here are the options. Option A, 1/4 inch. Option B,
1/2 inch.
Option C, 3/4 inch. Option D,
1 inch. The correct answer is option A.
1/4 inch. 1/4 inch is correct because sterile technique requires indicators, proper field handling, and avoiding contamination.
Question 54.
A provider orders an ESR to be performed on a patient and describes the test to the patient.
Which of the following statements made by the patient indicates an understanding of the teaching?
Here are the options. Option A, this test measures my estrogen serum ratio after menopause. Option B, this test measures the fluctuation of serum protein. Option C, this test measures my hemoglobin levels. Option D, this test measures the distance my RBCs have dropped.
The correct answer is option D.
This test measures the distance my RBCs have dropped. This test measures the distance my RBCs have dropped is correct because ESR measures how far red blood cells settle in a tube over a set time.
Question 55.
A patient who has a health maintenance organization insurance plan requests an appointment for a skin procedure. At which of the following times should the authorization for this procedure be approved? Here are the options. Option A, before the start of the procedure. Option B, by the end of the day. Option C, by the end of the procedure. Option D, before the start of the next billing cycle.
The correct answer is option A.
Before the start of the procedure. Before the start of the procedure is correct because required authorization must be approved before the service is performed.
Question 56. Which of the following actions should a medical assistant take to convey a friendly attitude during phone calls?
Here are the options. Option A.
Enunciate carefully.
Option B. Express a sense of urgency. Option C. Use medical jargon. Option D. Speak in a monotone pitch.
The correct answer is option A. Enunciate carefully. Enunciate carefully is correct because clear enunciation improves telephone communication and professionalism.
Question 57. The timing for a glucose tolerance test begins. Here are the options. Option A, when the fasting sample is drawn. Option B, when the test results are completed on the fasting sample. Option C, when the patient finishes drinking the glucose solution. Option D, 30 min after the patient finishes drinking the glucose solution.
The correct answer is option C.
When the patient finishes drinking the glucose solution.
When the patient finishes drinking the glucose solution is correct because timed specimens begin after the patient finishes the glucose drink. Question 58. According to OSHA, how often should a facility review and update its exposure control plan at minimum?
Here are the options. Option A.
Monthly.
Option B.
Biannually.
Option C.
Annually.
Option D.
Semi-annually. The correct answer is option C.
Annually. Annually is correct because OSHA requires ongoing safety measures, training, and exposure control practices for workplace hazards.
Question 59.
Which of the following conditions is a cause for specimen rejection for a routine urinalysis? Here are the options. Option A. Urine specimen volume is 6 ml. Option B. Urine specimen temperature is 23 C 73.4 F. Option C. Urine specimen container is missing a preservative. Option D.
Urine specimen is amber and turbid. The correct answer is option B.
Urine specimen temperature is 23 C 73.4 F.
Urine specimen temperature is 23 C 73.4 F is correct because an improper specimen temperature can indicate an unsuitable or delayed urine specimen. Question 60.
Part of a medical assistant's job is to inform the patient about which of the following? Here are the options. Option A. Preoperative and postoperative instructions. Option B.
Patient's diagnosis.
Option C. Laboratory result interpretation. Option D. Treatment options.
The correct answer is option A.
Preoperative and postoperative instructions. Preoperative and postoperative instructions is correct because patients need clear instructions for safe care before or after a procedure.
Question 61.
A provider will be performing a physical examination on a patient who has a sore throat. Which of the following supplies should the medical assistant prepare for the exam? Here are the options. Option A.
Otoscope.
Option B. Microscope slide. Option C.
Peak flow meter.
Option D.
Reagent strip. The correct answer is option D.
Reagent strip. Reagent strip is correct because rapid point-of-care testing may use reagent-based strips when evaluating a sore throat.
Question 62. A medical assistant should include which of the following instructions when providing a patient with information about the proper use of a transdermal patch?
Here are the options. Option A. Maintain the same site when applying new patches. Option B. Avoid exercising while the patch is in use. Option C. Do not shower while the patch is in place. Option D. Include the date and time on each patch applied.
The correct answer is option D.
Include the date and time on each patch applied. Include the date and time on each patch applied is correct because dating and timing the patch helps prevent duplicate dosing and supports safe medication use.
Question 63.
A medical assistant is submitting an urgent referral request to an insurance company for authorization.
Which of the following describes how long the authorization process will take?
Here are the options. Option A. 24 HRS. Option B. 3 working days. Option C. Immediate approval via phone. Option D. 10 days.
The correct answer is option C.
Immediate approval via phone. Immediate approval via phone is correct because urgent referral authorizations are handled immediately when the situation requires rapid approval.
Question 64.
A medical assistant is caring for the patient who has tuberculosis.
For which of the following transmission routes should the assistant take precautions?
Here are the options. Option A. Bloodborne. Option B. Airborne. Option C.
Vector-borne.
Option D.
Skin contact. The correct answer is option B.
Airborne. Airborne is correct because tuberculosis spreads by airborne droplet nuclei.
Question 65. Which of the following actions should a medical assistant take after obtaining a urine drug screen for a patient following a work-related accident?
Here are the options. Option A. Seal the lid in the presence of the patient. Option B. Return the sample to the provider's office within 36 HR. Option C. Check the urine specimen temperature within 15 min. Option D.
Confirm the patient's identity. The correct answer is option A.
Seal the lid in the presence of the patient. Seal the lid in the presence of the patient is correct because chain of custody procedures protect specimen identity and integrity from collection through transport.
Question 66.
When obtaining a head circumference measurement on an infant, where is the correct placement of the tape for the measurement? Here are the options. Option A. The most proximal portion of the nasal bridge. Option B. At the level of the external auditory meatus. Option C. A level slightly above the eyebrows. Option D. From the apex of the skull to the chin.
The correct answer is option C.
A level slightly above the eyebrows. A level slightly above the eyebrows is correct because infant head circumference is measured around the largest part of the head, slightly above the eyebrows.
Question 67.
Which of the following actions should a medical assistant take when performing an ear irrigation? Here are the options. Option A. Place the irrigation tip directly into the ear canal. Option B. Leave a cotton ball in place for 15 to 20 minutes following the procedure. Option C. Ensure the solution is warm prior to use. Option D. Send the solution to the laboratory for culture following the procedure.
The correct answer is option C.
Ensure the solution is warm prior to use.
Ensure the solution is warm prior to use is correct because proper ear irrigation requires correct pinner positioning and solution temperature to protect the ear. Question 68.
A provider is caring for a patient who has a kidney stone. The medical assistant should document this condition which of the following patient's chart. Here are the options. Option A. Nephrolithodarcies. Option B. Nephritis. Option C. Nephrosis. Option D. Nephrosclerosis.
The correct answer is option A.
Nephrolithodarcies. Nephrolithodarcies is correct because nephrolithodarcies is the medical term for kidney stones.
Question 69. Which of the following criteria are used to determine BMI?
Here are the options. Option A. Height and weight. Option B. Height and age. Option C. Weight and activity level. Option D. Weight and gender.
The correct answer is option A.
Height and weight. Height and weight is correct because BMI is calculated using height and weight.
Question 70.
A medical assistant pretends to be busy rather than speak to a coworker with whom they have conflict. The assistant is demonstrating which of the following types of passive-aggressive behavior. Here are the options. Option A.
Reflection.
Option B. Avoidance. Option C. Denial. Option D.
Distraction. The correct answer is option B.
Avoidance. Avoidance is correct because pretending to be busy to avoid a coworker is avoidance behavior.
Question 71.
A medical assistant is assisting a provider to obtain a specimen for a Papa-Nicolau test. Which of the following actions should the assistant take? Here are the options. Option A. Place the patient in the lithotomy position. Option B. Position the light source inside the vagina. Option C. Rinse the speculum in cool, sterile water before vaginal insertion. Option D.
Discard the specimen in a biohazard bag. The correct answer is option A.
Place the patient in the lithotomy position. Place the patient in the lithotomy position is correct because the lithotomy position provides access for collecting a Pap specimen. Question 72.
When performing surgical skin preparation, a medical assistant should use which of the following solutions?
Here are the options. Option A, topical lidocaine. Option B,
70% isopropyl alcohol.
Option C,
Hydrogen peroxide.
Option D,
Povidone iodine. The correct answer is option D.
povidone iodine. Povidone iodine is correct because povidone iodine is an antiseptic used for surgical skin preparation. Question 73. Which of the following laboratory tests require a medical assistant to follow the chain of custody protocol? Here are the options. Option A, blood alcohol level BAL. Option B, hepatitis B. Option C, CBC. Option D, radioalkylsorbent test RAST.
The correct answer is option A.
Blood alcohol level BAL. Blood alcohol level BAL is correct because forensic or legal specimens such as blood alcohol testing require chain of custody documentation.
Question 74.
The majority of a cell's DNA is located in which of the following organelles? Here are the options. Option A, ribosomes. Option B, mitochondria. Option C,
Nucleus.
Option D,
Endoplasmic reticulum. The correct answer is option C.
nucleus. Nucleus is correct because most cellular DNA is housed in the nucleus. Question 75. Which of the following methods of taking a patient's temperature poses a risk of exposure to blood-borne pathogens? Here are the options. Option A, temporal. Option B, oral. Option C,
Rectal.
Option D,
Axillary. The correct answer is option C.
rectal.
Rectal is correct because rectal temperatures may expose the assistant to blood or body fluids.
Question 76. After an infectious agent has infected a new host, which of the following steps is next in the cycle of infection? Here are the options. Option A,
Mode of transmission.
Option B, susceptible host. Option C,
Means of exit.
Option D, means of entry.
The correct answer is option C.
Means of exit. Means of exit is correct because after infection of a host, the organism must have a route to exit to continue the cycle. Question 77.
In which of the following positions should a medical assistant place a patient for a spirometry test?
Here are the options. Option A,
Chin tucked toward the chest.
Option B,
Seated upright with their chin elevated.
Option C, lying supine with their arms crossed. Option D, standing bent at the waist.
The correct answer is option B. Seated upright with their chin elevated. Seated upright with their chin elevated is correct because upright positioning with an elevated chin helps maximize airflow during spirometry.
Question 78. Which of the following is the first upward wave seen directly following the P wave on an EKG tracing? Here are the options. Option A, you wave. Option B, a wave. Option C,
S wave.
option D,
T wave. The correct answer is option B.
R wave. R wave is correct because the R wave is the first upward deflection in the QRS complex after the P wave. Question 79. A medical assistant is looking up diagnostic codes. Which of the following parts of the diagnostic statement should the assistant use when searching in the alphabet index? Here are the options. Option A,
E code.
option B, modifying term. Option C,
Main term.
option D,
Subterm. The correct answer is option C. Main term.
main term is correct because coders begin with the main term in the alphabetic index.
Question 80. A medical assistant is preparing a patient for cast application. Which of the following actions should the assistant complete before the provider begins the cast application?
Here are the options. Option A, observe the condition of the skin. Option B, wet the entire roll of fiberglass tape. Option C, place the stockinette in warm water. Option D, apply a pressure bandage below the fractured bone.
The correct answer is option A.
Observe the condition of the skin. Observe the condition of the skin is correct because skin condition should be assessed before applying a cast.
Question 81.
Complications such as poor wound healing, amputations, blindness, and kidney failure are associated with which of the following diseases? Here are the options. Option A, diabetes mellitus. Option B,
Acromegaly.
option C,
Cushing's syndrome.
option D, Graves' disease.
The correct answer is option A.
Diabetes mellitus. Diabetes mellitus is correct because chronic diabetes can cause poor wound healing, vascular disease, retinopathy, and kidney damage.
Question 82.
A medical assistant is confirming that a patient is in the basal state prior to a procedure. Which of the following responses by the patient is acceptable? Here are the options. Option A, I have not slept for the past 8 hours. Option B, I have not voided for 4 hours. Option C, I have not taken any medications for 10 hours. Option D, I have not eaten anything for 12 hours.
The correct answer is option D.
I have not eaten anything for 12 hours. I have not eaten anything for 12 hours is correct because basal state testing usually requires fasting and resting before the procedure.
Question 83.
A medical assistant has performed quality control testing on urine dipstick tests, which has failed to produce the required control results as per the package insert.
Which of the following actions should the assistant take?
Here are the options. Option A,
Verify the reagent solution expiration date.
Option B, warm the reagent solution and retest. Option C, dilute solution before retesting. Option D, chill the solution before retesting.
The correct answer is option A. Verify the reagent solution expiration date. Verify the reagent solution expiration date is correct because failed controls require checking the reagent and expiration before using patient results. Question 84. A medical assistant should expect a referral to which of the following allied health professionals for a patient who increased hemoglobin 1C level?
Here are the options. Option A,
Pathologist.
Option B,
Radiologist.
Option C,
Endocrinologist.
Option D,
Acupuncturist. The correct answer is option C. Endocrinologist. Endocrinologist is correct because endocrinologists manage diabetes and other hormone-related conditions. Question 85. Which of the following actions should a medical assistant take when communicating with a patient who speaks a different language than the assistant?
Here are the options. Option A, talk at a louder volume. Option B, maintain a closed posture. Option C, use explanatory gestures. Option D,
Notify the provider. The correct answer is option C.
use explanatory gestures. Use explanatory gestures is correct because gestures and other communication aids can support understanding when language barriers exist.
Question 86.
A medical assistant should recognize and report to the provider that which of the following patients has an apical pulse rate outside of the expected reference range. Here are the options. Option A, a 6-week-old infant who has a heart rate of 80/min. Option B, a 6-year-old child who has a heart rate of 80/min. Option C, a 16-year-old patient who has a heart rate of 80/min. Option D, a 60-year-old patient who has a heart rate of 80/min.
The correct answer is option A.
A 6-week-old infant who has a heart rate of 80/min. A 6-week-old infant who has a heart rate of 80/min is correct because a heart rate of 80/min is below the expected range for a young infant. Question 87.
In which of the following positions is the patient lying on his left side with his left leg slightly bent and his left arm behind his back?
Here are the options. Option A,
Fowler's.
Option B,
Trendelenburg.
Option C,
Sims.
Option D, Prudhomme.
The correct answer is option C. Sims. Sims is correct because Sims' position places the patient on the left side with the left leg slightly flexed. Question 88. A provider refers a patient for an MRI of their left arm.
Which of the following actions should the medical assistant complete before the patient leaves the office? Here are the options. Option A, confirm demographic and insurance information. Option B, obtain a surgical informed consent to keep on file. Option C, request a stat referral. Option D, provide postoperative instructions.
The correct answer is option A.
Confirm demographic and insurance information. Confirmed demographic and insurance information is correct because referral scheduling requires accurate demographic and insurance information.
Question 89.
Which of the following methods of examination is used to observe for deformities and rashes on the patient's body? Here are the options. Option A,
Auscultation.
Option B, palpation. Option C,
Inspection.
Option D,
Percussion. The correct answer is option C, inspection.
Inspection is correct because inspection means visually observing the body for abnormalities.
Question 90.
A medical assistant who is screening for depression should identify which of the following is a common manifestation. Here are the options. Option A,
Increased energy.
Option B,
Decreased appetite.
Option C,
Improved mental acuity.
Option D, uninterrupted sleep pattern.
The correct answer is option B,
Decreased appetite. Decreased appetite is correct because depression can be associated with stress and may cause appetite and mood changes.
Question 91.
A medical assistant successfully obtains a prior authorization for services for a patient. The insurance will provide which of the following as confirmation. Here are the options. Option A,
Relative value scale.
Option B, indemnity schedule. Option C,
Authorization number.
Option D, certification number.
The correct answer is option C, authorization number.
Authorization number is correct because managed care and some procedures require insurer approval before the service is performed.
Question 92.
During a physical examination, a medical assistant might witness the provider tapping a patient's body, usually with fingers or a small hammer, to elicit sounds or vibratory sensations. What is the name of this examination technique? Here are the options. Option A, palpitation. Option B,
Auscultation.
Option C,
Percussion.
Option D,
Manipulation. The correct answer is option C,
percussion. Percussion is correct because percussion means tapping the body to produce sounds or vibrations during an examination.
Question 93. A medical assistant is transferring a patient from his wheelchair to an examination table by herself. Which of the following actions should the assistant take?
Here are the options. Option A, bend at the knees when lifting the patient. Option B, remove the patient's shoes before transferring. Option C, instruct the patient to hold the medical assistant's waist. Option D, interlock wrists behind the patient's back.
The correct answer is option A,
Bend at the knees when lifting the patient. Bend at the knees when lifting the patient is correct because proper body mechanics reduce injury risk during patient transfer.
Question 94. A medical assistant should identify that which of the following can result from stress due to financial trouble.
Here are the options. Option A, midlife crisis. Option B,
depression.
Option C, white coat syndrome. Option D,
failure to thrive. The correct answer is option B,
depression. Depression is correct because depression can be associated with stress and may cause appetite and mood changes.
Question 95. Which of the following actions should a medical assistant take prior to obtaining an EKG tracing?
Here are the options. Option A,
calibrate the machine.
Option B, check for the presence of artifacts. Option C,
attach electrodes to the skin using adhesive gel.
Option D,
wipe down the lead wires using isopropyl alcohol. The correct answer is option C, attach electrodes to the skin using adhesive gel. Attach electrodes to the skin using adhesive gel is correct because electrodes must be properly attached before obtaining an EKG tracing. Question 96.
A medical assistant should identify that which of the following tasks requires the use of gloves. Here are the options. Option A, obtaining a tympanic reading. Option B, administering a nebulizer treatment. Option C, performing a visual acuity test. Option D,
removing a cyst. The correct answer is option D, removing a cyst.
Removing a cyst is correct because gloves are required when contact with blood, body fluids, mucous membranes, or sterile tissue is likely. Question 97. Which of the following is the purpose of inverting an evacuated tube after a medical assistant performs a venipuncture? Here are the options. Option A, to distribute serum during centrifugation. Option B,
to retrieve the liquid portion without cellular contamination of the specimen.
Option C,
for proper separation of sodium heparin.
Option D, for proper mixing of the additive contained in the tube and the specimen.
The correct answer is option D,
for proper mixing of the additive contained in the tube and the specimen. For proper mixing of the additive contained in the tube and the specimen is correct because inversion mixes the specimen with the tube additive to prevent inaccurate results.
Question 98. A medical assistant is caring for a patient whose blood pressure drops to a dangerously low level.
The assistant should place the patient into which of the following positions? Here are the options. Option A,
lithotomy.
Option B,
Fowler's.
Option C, Fridolin. Option D,
Trendelenburg. The correct answer is option D,
Trendelenburg.
Trendelenburg is correct because Trendelenburg can help support circulation when blood pressure is dangerously low.
Question 99. A medical assistant obtains an elevated blood pressure reading from a visibly upset patient.
Which of the following actions should the assistant take?
Here are the options. Option A, perform orthostatic blood pressure. Option B, recheck the blood pressure after a few minutes. Option C, measure blood pressure at the wrist. Option D, use the palpatory method for blood pressure.
The correct answer is option B.
Recheck the blood pressure after a few minutes.
Recheck the blood pressure after a few minutes is correct because the value is outside the expected range or requires reassessment based on patient condition.
Question 100. A patient consistently shows up late to regularly scheduled office appointments.
Which of the following actions should the medical assistant take?
Here are the options. Option A. Schedule the patient with a different provider. Option B. Send the patient a discharge letter. Option C. Schedule the patient for the last appointment of the day. Option D.
Refer the patient to the emergency department. The correct answer is option C.
Schedule the patient for the last appointment of the day.
Schedule the patient for the last appointment of the day is correct because placing chronically late patients at the end of the day reduces disruption to other patients. Question 101. Which of the following medication routes does a medical assistant administer topically?
Here are the options. Option A.
Subcutaneous.
Option B. Transdermal. Option C.
Intramuscular.
Option D. Percutaneous.
The correct answer is option B.
Transdermal. Transdermal is correct because transdermal medications are applied to the skin for absorption.
Question 102.
Which of the following techniques should a medical assistant use when passing the provider a scalpel during a sterile procedure? Here are the options. Option A.
Blade down and handle first.
Option B.
Blade up using forceps to pass.
Option C. Blade sideways on a separate Mayo stand. Option D. Blade capped, using a skin retractor to pass.
The correct answer is option A. Blade down and handle first.
Blade down and handle first is correct because sterile technique requires indicators, proper field handling, and avoiding contamination.
Question 103. Which of the following is an effect of hemostasis?
Here are the options. Option A.
It prevents fibrinolysis of the blood.
Option B.
It prevents the process of clot formation.
Option C.
It promotes destruction of RBCs.
Option D.
It promotes coagulation. The correct answer is option D. It promotes coagulation. It promotes coagulation is correct because hemostasis is the process that stops bleeding through clot formation. Question 104.
Which of the following legal documents appoints healthcare proxy to make medical decisions for a patient in the event that they cannot? Here are the options. Option A. Durable power of attorney. Option B. Mature minor doctrine. Option C. Living will. Option D.
Medical record release. The correct answer is option A.
Durable power of attorney. Durable power of attorney is correct because a durable power of attorney for healthcare appoints someone to make decisions if the patient cannot.
Question 105.
An influenza vaccination was ordered by the provider and performed on the patient by the medical assistant.
Which of the following information should the assistant document in the patient's chart upon completion of this procedure?
Here are the options. Option A, payment method. Option B, compound of the vaccination. Option C, expiration date and lot number. Option D, ICD-10 and CPT code for the vaccination.
The correct answer is option C,
expiration date and lot number. Expiration date and lot number is correct because vaccine documentation must include details such as lot number and expiration date.
Question 106.
A medical assistant should apply eye drops to which of the following structures of the patient's eye? Here are the options. Option A,
conjunctiva.
Option B, lens. Option C,
retina.
Option D, iris.
The correct answer is option A, conjunctiva.
Conjunctiva is correct because ophthalmic drops are placed in the conjunctival sac.
Question 107.
Which of the following should be reported to the safety team to ensure the medical office is prepared for a fire? Here are the options. Option A, fire extinguisher's pins are intact. Option B, multi-plug adapters are not in use. Option C, sprinkler heads are unobstructed. Option D, one emergency exit is available.
The correct answer is option D.
One emergency exit is available. One emergency exit is available is correct because having only one available emergency exit is a safety concern that should be reported.
Question 108.
Which of the following drug classifications describes medications used to lower body temperature? Here are the options. Option A, analgesics. Option B,
antipruritic.
Option C,
anticoagulants.
Option D, antipyretics.
The correct answer is option D,
antipyretics.
Antipyretics is correct because antipyretic medications reduce fever. Question 109. To make 100 ml of a 10% bleach solution, which of the following should the medical assistant combine?
Here are the options. Option A, 10 ml distilled water with 90 ml bleach. Option B, 10 ml bleach with 90 ml distilled water. Option C, 50 ml distilled water with 50 ml bleach. Option D, 1 ml bleach with 99 ml distilled water.
The correct answer is option B,
10 ml bleach with 90 ml distilled water. 10 ml bleach with 90 ml distilled water is correct because a 10% solution is made with 10 parts bleach per 100 total parts solution.
Question 110. Which of the following route should be used for an insulin injection?
Here are the options. Option A,
intradermal.
Option B,
subcutaneous.
Option C, intravenous. Option D,
intramuscular. The correct answer is option B, subcutaneous. Subcutaneous is correct because insulin is commonly administered by the subcutaneous route. Question 111.
A medical assistant receives a telephone call from a parent whose child has ingested a cleaning solution.
Which of the following actions should the medical assistant take?
Here are the options. Option A. Instruct the parent to contact the manufacturer of the cleaning solution. Option B. Instruct the parent to induce vomiting in the child. Option C. Instruct the parent to have the child drink 240 ml of water. Option D. Instruct the parent to call the Poison Control Center.
The correct answer is option D.
Instruct the parent to call the Poison Control Center. Instruct the parent to call the Poison Control Center is correct because poison control provides immediate guidance for possible poisoning. Question 112. A medical assistant is obtaining a blood pressure reading from an adult patient. For which of the following readings should the assistant contact the provider? Here are the options. Option A.
100/60 mmHg.
Option B. 98/68 mmHg. Option C.
184/45 mmHg.
Option D. 122/60 mmHg.
The correct answer is option C. 184/45 mmHg. 104/45 mmHg is correct because the value is outside the expected range or requires reassessment based on patient condition.
Question 13. A medical assistant is performing a body fat measurement on a patient.
Which of the following areas should the assistant use to obtain an accurate measurement?
Here are the options. Option A.
Gluteus maximus.
Option B. Biceps. Option C. Infrailiac region. Option D. Triceps.
The correct answer is option D.
Triceps. Triceps is correct because the triceps skin fold is a common site for body fat assessment.
Question 114. At which of the following times during a phlebotomy procedure should a medical assistant label the tubes?
Here are the options. Option A. Upon the patient's arrival to the laboratory. Option B. After applying the tourniquet to the patient's arm. Option C. After disposing of the used needle. Option D. Prior to inverting each tube.
The correct answer is option C.
After disposing of the used needle. After disposing of the used needle is correct because tubes should be labeled after collection and after safe needle disposal while the patient is still present.
Question 15. Which of the following should a medical assistant recognize as a patient transition of care?
Here are the options. Option A.
Consultation with a pharmacist.
Option B. Screening by a psychiatrist. Option C.
Admission to a hospital.
Option D.
Assessment with a nutritionist. The correct answer is option C.
Admission to a hospital.
Admission to a hospital is correct because admission to a hospital transfers the patient from one care setting to another. Question 116. When considering a site for an intramuscular injection, which of the following will be appropriate for an infant?
Here are the options. Option A.
Dorsogluteal.
Option B. Deltoid. Option C, vastus lateralis. Option D, gluteus medius.
The correct answer is option C,
vastus lateralis. Vastus lateralis is correct because the vastus lateralis is the preferred IM site for infants. Question 117. A medical assistant enters the laboratory where a patient is already seated.
Which of the following should the assistants do first?
Here are the options. Option A, wash hands and put on gloves. Option B,
gather necessary supplies.
Option C,
identify the patient.
Option D,
label the tubes. The correct answer is option C, identify the patient.
Identify the patient is correct because patient identification must occur before collection or treatment.
Question 118.
Escherichia coli is classified as which of the following? Here are the options. Option A, gram-positive coccus. Option B,
acid-fast bacillus.
Option C, gram-negative spirillum. Option D, gram-negative bacillus.
The correct answer is option D,
gram-negative bacillus. Gram-negative bacillus is correct because E. coli is classified as a gram-negative bacillus. Question 19. Which of the following charts would be used to test for color vision? Here are the options. Option A, E chart. Option B, Snellen chart. Option C, Ishihara chart. Option D,
Jaeger chart. The correct answer is option C,
Ishihara chart. Ishihara chart is correct because Ishihara plates test color vision.
Question 120. Which of the following should a medical assistant instruct a patient to do before a scheduled pulmonary function test?
Here are the options. Option A, consume dairy products in limited amounts. Option B, refrain from using bronchodilators. Option C, undergo a nebulizer treatment 3 hours before the test begins. Option D, perform a cardiac stress test prior to arrival.
The correct answer is option B,
refrain from using bronchodilators.
Refrain from using bronchodilators is correct because bronchodilators can alter pulmonary function test results.
Question 121. Which of the following instruments is used to grasp tissue during procedure? Here are the options. Option A,
speculum.
Option B, forceps. Option C,
curette.
Option D,
probe. The correct answer is option B,
forceps.
Forceps is correct because forceps are used to grasp or hold tissue during procedures.
Question 122. A medical assistant is speaking with a patient on the phone who is billing questions.
Which of the following actions by the assistant demonstrates active listening?
Here are the options. Option A, formulates a response while the patient is talking. Option B, focuses solely on the conversation. Option C, interjects into the conversation to offer solutions. Option D,
asks the patient to hold to answer coworker's question. The correct answer is option B.
Focuses solely on the conversation. Focuses solely on the conversation is correct because active listening requires giving full attention to the speaker. Question 23.
A medical assistant is preparing to administer an intramuscular injection to a child who weighs 50 lb. To calculate the correct dosage, the assistant should determine that which of the following is the weight of the child in kg.
Here are the options. Option A,
21.2.
Option B, 22.7. Option C, 23.7. Option D,
24. The correct answer is option B.
22.7. 22.7 is correct because 50 lb divided by 2.2 equals about 22.7 kg.
Question 124.
Which of the following supplements is recommended for patients who have osteoporosis? Here are the options. Option A, vitamin D. Option B, iron. Option C,
Folic acid.
Option D, thiamine.
The correct answer is option A.
Vitamin D. Vitamin D is correct because vitamin D supports calcium absorption in bone health. Question 125. Which of the following resources should a medical assistant use to obtain the outside laboratory results of a patient? Here are the options. Option A,
Electronic medical record EMR.
Option B,
Electronic health record EHR.
Option C, electronic fund transfers EFT. Option D, explanation of benefits EOB.
The correct answer is option B. Electronic health record EHR.
Electronic health record EHR is correct because an EHR can include shared health information from outside sources.
Question 126.
Which of the following needle sizes should a medical assistant select for an intradermal injection? Here are the options. Option A, 13 to 16 gauge. Option B, 17 to 20 gauge. Option C, 21 to 24 gauge. Option D, 25 to 28 gauge.
The correct answer is option D.
25 to 28 gauge. 25 to 28 gauge is correct because intradermal injections use small gauge needles, commonly 25 to 28 gauge. Question 127. A medical assistant has a question about accreditation standards for the provider's office.
Which of the following resources should the assistant consult?
Here are the options. Option A,
The Joint Commission.
Option B,
OSHA.
Option C,
The Affordable Care Act.
Option D,
Clear. The correct answer is option A.
the Joint Commission. The Joint Commission is correct because the Joint Commission accredits healthcare organizations.
Question 128.
Which of the following types of billing sends statements to patients as scheduled times of the month throughout the month? Here are the options. Option A, monthly billing. Option B, cycle billing. Option C, third-party billing. Option D,
twice-month billing. The correct answer is option B,
cycle billing. Cycle billing is correct because cycle billing sends statements to different groups of patients on scheduled days throughout the month.
Question 129. Which of the following outcomes should a medical assistant expect from reinforcing teaching about a new medication treatment plan with a patient?
Here are the options. Option A,
charting accuracy.
Option B, patient compliance. Option C,
increased patient defensiveness.
Option D,
decreased medication efficacy. The correct answer is option B,
patient compliance.
Patient compliance is correct because reinforcement of medication teaching supports correct use and adherence. Question 30. A medical assistant is preparing to place lower limb electrodes on a patient who is left above the knee amputation. Which of the following actions should the assistant take when placing a lower limb electrodes?
Here are the options. Option A,
place the left electrode on the most distal portion of the left limb and the most proximal portion of the right limb.
Option B,
place the left electrode on the most distal portion of left limb and place the right electrode on the right groin.
Option C,
place the left electrode on the left mid-thigh and place the right electrode on the right mid-thigh.
Option D,
place the left electrode at the most proximal portion of the right limb and place the right electrode at the most distal portion of the right limb. The correct answer is option C. Place the left electrode on the left mid-thigh and place the right electrode on the right mid-thigh. Place the left electrode on the left mid-thigh and place the right electrode on the right mid-thigh is correct because limb electrodes should be placed symmetrically on comparable sites when possible. Question 131.
Which of the following information is needed to complete CMS 1500 form? Here are the options. Option A, provider's drug enforcement agency number. Option B, provider's federal tax identification number. Option C, patient's emergency contact information. Option D,
patient's organ donor information. The correct answer is option B,
provider's federal tax identification number.
Provider's federal tax identification number is correct because the CMS 1500 is the standard professional outpatient claim form and requires provider tax identification data. Question 832.
Which of the following actions should a medical assistant take during hand washing? Here are the options. Option A,
use a 25% alcohol-based hand soap.
Option B, use liquid soap and friction. Option C,
use a nail brush to clean jewelry with stones.
Option D, rinse the hands with the fingertips facing upward.
The correct answer is option B.
Use liquid soap and friction. Use liquid soap and friction is correct because proper hand washing requires liquid soap, water, and friction.
Question 133. Into which of the following positions should a medical assistant assist a patient in preparation for an abdominal examination?
Here are the options. Option A,
Sims.
Option B,
Dorsal recumbent.
Option C, supine. Option D,
Fowler's. The correct answer is option C.
supine. Supine is correct because the supine position exposes and relaxes the abdomen for examination.
Question page 34. A medical assistant notices a patient on tomorrow's schedule has an account balance of $15.00.
The patient's copayment is $20.00. Which of the following amounts is the minimum that the assistant should collect from the patient on the day of the appointment? Here are the options. Option A, $40.00. Option B, $5.00. Option C, $15.00. Option D, $20.00.
The correct answer is option D.
$20.00. $20.00 is correct because the copayment due for the current visit should be collected at check-in or check-out. Question 35. A medical assistant has orders to collect blood cultures, CBC, PTT, and an ion panel from a patient.
Which of the following tubes should the assistant draw second?
Here are the options. Option A,
Red marble.
Option B, light blue. Option C,
Yellow.
Option D, lavender.
The correct answer is option B.
Light blue. Light blue is correct because blood cultures are drawn first, and coagulation specimens in light blue tubes are next in the order of draw. Question 136.
A provider instructs a medical assistant to refer patient to community resources for additional statistical information following a CABG surgery. To which of the following resources should the assistant refer the patient for this service?
Here are the options. Option A,
American Red Cross.
Option B,
American Heart Association.
Option C,
American Lung Association.
Option D, American Board of Surgery.
The correct answer is option B.
American Heart Association. American Heart Association is correct because the American Heart Association provides cardiac education and resources after heart procedures. Question 137. Smoking is a risk factor for which of the following conditions? Here are the options. Option A, cervicitis. Option B,
Pericarditis.
Option C, Graves' disease. Option D,
Atherosclerosis. The correct answer is option D. Atherosclerosis. Atherosclerosis is correct because smoking damages blood vessels and increases atherosclerosis risk. Question 38.
Which of the following methods should a medical assistant use when weighing a patient who has balance issues? Here are the options. Option A, have the patient hold on to the wall while weighing. Option B, position a walker over the scale. Option C,
Position a cane on the scale between her feet.
Option D, have the patient sit in a chair on the scale.
The correct answer is option B.
Position a walker over the scale. Position a walker over the scale is correct because positioning a walker over the scale provides stability without adding the patient's weight support to the reading.
Question 239.
A medical assistant is reinforcing teaching about a 24-HR Holter monitor test with a patient.
Which of the following statements should the assistant include in the teaching?
Here are the options. Option A. Avoid any physical exertion while wearing the electrodes. Option B.
Minimize your salt intake during the test.
Option C.
Avoid getting the electrodes wet.
Option D.
Ensure that you get an additional 2 hours of sleep during the test. The correct answer is option C. Avoid getting the electrodes wet.
Avoid getting the electrodes wet is correct because Holter monitoring records cardiac activity while the patient logs symptoms, activities, and events during the test.
Question 140.
Which of the following actions should a medical assistant take to comply with chain of custody principles for urine drug testing? Here are the options. Option A. Ship the specimen to the reference of laboratory on the day of collection. Option B. Observe the patient pouring the urine from the cup into the specimen container. Option C. Have the patient sign the forms and labels before specimen collection. Option D. Provide a physician's signature on all labels.
The correct answer is option B.
Observe the patient pouring the urine from the cup into the specimen container.
Observe the patient pouring the urine from the cup into the specimen container is correct because chain of custody procedures protect specimen identity and integrity from collection through transport. Question 141.
Which of the following findings should a medical assistant identify as a manifestation of anaphylaxis during an intake examination? Here are the options. Option A. Urticaria. Option B.
Ecchymosis.
Option C.
Uremia.
Option D. Abrasion.
The correct answer is option A.
Urticaria. Urticaria is correct because urticaria, or hives, is a common manifestation of allergic reactions including anaphylaxis.
Question 842.
Restriction of the flow of oxygen-rich blood to a part of the body is referred to as which of the following? Here are the options. Option A.
Ischemia.
Option B. Hypertrophy. Option C.
Hypertrophy.
Option D.
Necrosis. The correct answer is option A.
Ischemia. Ischemia is correct because ischemia means restricted blood flow to tissue.
Question 843. Which of the following manifestations is associated with infectious mononucleosis?
Here are the options. Option A.
Rhinorrhea.
Option B.
Sarcoidosis.
Option C. Extreme fatigue. Option D. Open sores.
The correct answer is option C.
Extreme fatigue. Extreme fatigue is correct because extreme fatigue is a classic symptom of infectious mononucleosis.
Question 144.
Which of the following planes divides the body into superior and inferior portions? Here are the options. Option A,
sagittal.
Option B,
coronal.
Option C, transverse. Option D, frontal.
The correct answer is option C,
transverse. Transverse is correct because the transverse plane divides the body into upper and lower portions.
Question 145.
Who is responsible for retrieving stat laboratory test results from an outside laboratory? Here are the options. Option A,
provider.
Option B, medical receptionists. Option C,
patient.
Option D,
medical assistant. The correct answer is option A, provider.
Provider is correct because the provider is responsible for ensuring urgent test results are obtained and acted upon.
Question 146. Which of the following steps should a medical assistant take in preparation for obtaining a weight measurement from a patient?
Here are the options. Option A, have the patient remove clothes before measurement. Option B, ensure the scale is balanced. Option C, disinfect the scale with cavicide. Option D, put on gloves.
The correct answer is option B,
ensure the scale is balanced. Ensure the scale is balanced is correct because the scale must be balanced or zeroed before obtaining the patient's weight.
Question 147.
A medical assistant is caring for a patient who reports a throbbing headache and a family history of migraines.
The assistant should record this information in the patient's chart as which of the following?
Here are the options. Option A,
assessment.
Option B,
social history.
Option C,
chief complaint.
Option D, review of systems.
The correct answer is option C, chief complaint.
Chief complaint is correct because the chief complaint is the patient's main reason for seeking care.
Question 148. Which of the following properly documents those 2 drops of an ear medication were administered to the patient's left ear at 3:00 p.m.?
Here are the options. Option A, 1500 Roman 2 GTT left ear. Option B,
0300 Roman 2 GR left ear.
Option C, 1500 Roman 2 ml left ear. Option D,
0300 Roman 2 mcg left ear. The correct answer is option A,
1500 Roman 2 GTT left ear. 1500 Roman 2 GTT left ear is correct because drops are documented as GTT and 3:00 p.m. is written as 1500 in military time.
Question 149.
A medical assistant should ensure that which of the following pieces of equipment is in the room for a patient who is having a contact lens evaluation. Here are the options. Option A,
otoscope.
Option B, tympanometry. Option C, sphygmomanometer. Option D, ophthalmoscope.
The correct answer is option D.
Ophthalmoscope. Ophthalmoscope is correct because an ophthalmoscope is used to examine internal eye structures.
Question 50. A medical assistant is acting as a sterile scrub assistant. Which of the following actions should the assistant take?
Here are the options. Option A.
Tear the corner when opening the 4x4 package.
Option B. Maintain a 1-inch border around the sterile field. Option C. Wear non-latex gloves. Option D. Lay the instruments gently on the sterile field.
The correct answer is option B.
Maintain a 1-inch border around the sterile field. Maintain a 1-inch border around the sterile field is correct because sterile technique requires indicators, proper field handling, and avoiding contamination.
Question 59.
A patient is scheduled for a 6-month follow-up for diabetes mellitus. Which of the following information should the medical assistant include in the patient's medical record to ensure comprehensive care? Here are the options. Option A. Hemoglobin A1C results. Option B.
EKG test results.
Option C. Chest X-ray results. Option D. Patient INR results.
The correct answer is option A.
Hemoglobin A1C results. Hemoglobin A1C results is correct because A1C reflects long-term blood glucose control for diabetes follow-up care.
Question 52.
A patient is scheduled for an orthopedic consultation. The medical assistant should ensure the health record includes which of the following? Here are the options. Option A. Urinalysis results. Option B.
Radiology report.
Option C. Tympanometry measurements. Option D. Lipid panel.
The correct answer is option B.
Radiology report.
Radiology report is correct because orthopedic evaluation often requires relevant imaging reports. Question 53.
A medical assistant is a patient who has a PPO insurance plan.
The provider would like the patient to see a cardiologist. Which of the following forms should the medical assistant use for this request?
Here are the options. Option A. Referral. Option B.
Authorization.
Option C. Pre-certification. Option D.
Verification of eligibility. The correct answer is option A.
Referral
is correct because a referral form communicates the provider's request for specialty evaluation. Question 54. Which of the following terms describes a situation in which a medical assistant codes a greater level than the services provided?
Here are the options. Option A.
Downcoding.
Option B.
Accoding.
Option C.
CPT code.
Option D.
HCPCS code. The correct answer is option B. Accoding.
Accoding is correct because accoding means billing a higher level of service than was actually provided.
Question 155.
A medical assistant is preparing for an examination room for a patient who reports ear pain and nausea.
Which of the following pieces of equipment should the assistant place in the room of examination?
Here are the options. Option A,
Otoscope.
Option B, ophthalmoscope. Option C, percussion hammer. Option D,
Biopsy punch. The correct answer is option A.
otoscope. Otoscope is correct because an otoscope is used to examine the ear.
Question 156.
A medical assistant obtains a pulse rate of 105/min from a patient who is a marathon runner. Which of the following should the assistant document in the patient's health record? Here are the options. Option A,
Tachycardia.
Option B, bradycardia. Option C,
Hypopnea.
Option D, bradypnea.
The correct answer is option A. Tachycardia.
Tachycardia is correct because an adult pulse above 100/min is tachycardia.
Question 157.
To be in compliance with HIPAA, a medical assistant should ensure that which of the following statements is provided to patients. Here are the options. Option A,
Confidentiality statement.
Option B, policies and procedures statement. Option C, waiver of accountability statement. Option D, aider accommodations statement.
The correct answer is option A.
Confidentiality statement.
Confidentiality statement is correct because HIPAA requires protecting patient confidentiality and privacy. Question 58. Which of the following actions should a medical assistant take when a patient refuses a prescribed treatment?
Here are the options. Option A,
Advise the patient on the best course of treatment.
Option B, warn the patient about the consequences of his decision. Option C, encourage the patient to discuss his concerns with the provider. Option D,
Discuss his feelings with the patient and share a similar experience. The correct answer is option C.
encourage the patient to discuss his concerns with the provider. Encourage the patient to discuss his concerns with the provider is correct because patients should be encouraged to discuss concerns with the provider before deciding.
Question 59.
Which of the following items is necessary for a postoperative suture removal procedure? Here are the options. Option A, sterile needle holder. Option B, 1 ml syringe with an 18-gauge needle. Option C,
4x4-inch benzalkonium wipes.
Option D, sterile thumb dressing forceps.
The correct answer is option D.
Sterile thumb dressing forceps. Sterile thumb dressing forceps is correct because sterile thumb forceps help lift and remove sutures safely.
Question 160.
When a medical assistant is taking a patient's blood pressure, which of the following court cough sounds represent the systolic blood pressure? Here are the options. Option A,
Swooshing.
Option B,
Soft and muffled.
Option C, faint and pulsing. Option D, tapping.
The correct answer is option D.
Tapping. Tapping is correct because the first tapping Korotchkov sound represents systolic blood pressure.
Question 161.
A medical assistant is preparing to review the medication dosage and instructions for a patient who has just seen the provider. Which of the following parts of the progress note should the assistant review for this information? Here are the options. Option A, plan of care. Option B, objective data. Option C, assessment of the problem. Option D, subjective data.
The correct answer is option A,
plan of care.
Plan of care is correct because medication instructions and next steps are recorded in the plan of care. Question 162. The partner of a patient comes into the office demanding to know what the patient was seen for and why he was charged for the visit. What is the best way for the medical assistant to handle this situation when no authorization to release health information is on file?
Here are the options. Option A,
advise him that privacy regulations prevent releasing patient information regardless of his relationship to the patient.
Option B,
verbally share the patient information with him since he is the subscriber on the patient's medical insurance.
Option C, reassure him that he has nothing to worry about since his partner's visit was only a follow-up to a minor surgery. Option D,
instruct him to provide proof of identity prior to providing the requested information. The correct answer is option A. Advise him that privacy regulations prevent releasing patient information regardless of his relationship to the patient. Advise him that privacy regulations prevent releasing patient information regardless of his relationship to the patient is correct because protected health information cannot be released without proper authorization.
Question 163. Which of the following is a reason to perform an eye irrigation? Here are the options. Option A, to relieve inflammation and discomfort. Option B, to prepare for a contact lens examination. Option C, to diagnose the presence of glaucoma. Option D,
to release a collection of excess endolymph fluid. The correct answer is option A,
to relieve inflammation and discomfort. To relieve inflammation and discomfort is correct because eye irrigation can remove irritants and reduce discomfort.
Question 164.
A medical assistant obtains a blood glucose reading from a patient who has type 1 diabetes mellitus.
For which of the following values should the assistant notify the provider immediately?
Here are the options. Option A, 210 mg/dl. Option B, 30 mg/dl. Option C, 85 mg/dl. Option D, 275 mg/dl.
The correct answer is option B,
30 mg/dl. 30 mg/dl is correct because it represents severe hypoglycemia and should be reported immediately. Question 165. A medical assistant is preparing to attach electrodes to a patient for Holter monitoring.
Which of the following actions should the assistant take when preparing a site for electrode placement?
Here are the options. Option A,
Cleanse the site with chlorhexidine.
Option B. Mark the site with a permanent marker. Option C. Shave any body hair at the site. Option D.
Apply electroconductive gel to the site. The correct answer is option C.
Shave any body hair at the site.
Shave any body hair at the site is correct because removing excess hair improves electrode contact and tracing quality. Question 166. Which of the following is the route of transmission for syphilis?
Here are the options. Option A.
Sexual contact.
Option B. Respiratory droplets. Option C.
Contaminated food.
Option D.
Tick bite. The correct answer is option A.
Sexual contact. Sexual contact is correct because syphilis is transmitted primarily through sexual contact. Question 167.
A medical assistant should identify that a pregnancy test detects which of the following hormones.
Here are the options. Option A.
FSH.
Option B.
HCG.
Option C. GHRH. Option D. LH.
The correct answer is option B. HCG.
HCG is correct because pregnancy tests detect human chorionic gonadotropin.
Question 168.
A medical assistant should recognize that the need for spontaneity and creativity belongs in which of the following levels in Maslow's hierarchy of needs? Here are the options. Option A. Physiological. Option B. Love and belonging. Option C.
Esteem.
Option D. Self-actualization.
The correct answer is option D.
Self-actualization. Self-actualization is correct because creativity and spontaneity belong to the self-actualization level.
Question 169.
A medical assistant is reinforcing teaching with a patient about medication administration in the ear. Which of the following information should the assistant include? Here are the options. Option A. The medication is usually administered in ointment form. Option B. The medication might result in adverse systemic side effects. Option C. The medication will take 5 to 10 min to be absorbed into the bloodstream. Option D. The medication should be warmed in the hands prior to administration.
The correct answer is option D.
The medication should be warmed in the hands prior to administration.
The medication should be warmed in the hands prior to administration is correct because warming ear medication helps reduce dizziness and discomfort.
Question 170.
Which of the following actions should a medical assistant take when performing a capillary puncture on a 10-month-old patient?
Here are the options. Option A.
Place a bandage on the site after holding pressure for 1 min.
Option B. Apply direct, firm pressure to the puncture site on the finger. Option C. Warm the site for a minimum of 10 min prior to puncture. Option D. Have the parent hold the child during the procedure.
The correct answer is option D.
Have the parent hold the child during the procedure.
Have the parent hold the child during the procedure is correct because a parent can help safely mobilize and comfort an infant during capillary collection. Question 171. Which of the following forms should a medical assistant give to a patient when Medicare might not cover services or items?
Here are the options. Option A,
Encounter form.
Option B,
Advance beneficiary notice ABN.
Option C, Explanation of benefits EOB. Option D, CMS 1500.
The correct answer is option B.
Advance beneficiary notice ABN.
Advance beneficiary notice ABN is correct because an ABN notifies Medicare patients that a service might not be covered. Question 172. Which of the following actions should a medical assistant take when performing ear irrigation for an adult patient?
Here are the options. Option A, pull the pinner up and back. Option B, warm the solution to 16.67 C62F. Option C, place the patient in the prone position. Option D, insert the barrel of the syringe in the meatus of the patient's ear.
The correct answer is option A.
Pull the pinner up and back.
Pull the pinner up and back is correct because proper ear irrigation requires correct pinner positioning and solution temperature to protect the ear.
Question 173.
If a patient wishes to withhold life-sustaining treatment, which of the following advance directives should the medical assistant add the patient's chart?
Here are the options. Option A, against medical advice AMA form. Option B, do not resuscitate DNR prescription. Option C, organ donation card. Option D,
durable power of attorney for healthcare D Park. The correct answer is option B.
Do not resuscitate DNR prescription. Do not resuscitate DNR prescription is correct because a DNR order documents the patient's wish not to receive resuscitation.
Question 174. Which of the following instructions should a medical assistant give to a patient about the use of a Holter monitor equipped with an event marker?
Here are the options. Option A, press the marker when the monitoring period begins. Option B, press the marker when you stand up. Option C, press the marker when symptoms begin. Option D, press the marker when your exercise routine begins.
The correct answer is option C.
Press the marker when symptoms begin. Press the marker when symptoms begin is correct because Holter monitoring records cardiac activity while the patient logs symptoms, activities, and events during the test.
Question 175.
Which of the following clinical situations requires a medical assistant to apply sterile gloves? Here are the options. Option A, assisting in suturing. Option B, obtaining a throat culture. Option C, pouring sterile solutions during a procedure. Option D, assisting in an endoscopic procedure.
The correct answer is option A.
Assisting in suturing. Assisting in suturing is correct because sterile gloves are required when assisting with a sterile invasive procedure.
Question 176.
While interviewing a patient, a medical assistant should recognize which of the following as a sign of possible substance abuse. Here are the options. Option A, stable weight. Option B, active listening. Option C, reactive pupillary reflex. Option D,
erratic thought pattern. The correct answer is option D,
erratic thought pattern. Erratic thought pattern is correct because erratic thoughts can be a behavioral sign associated with substance abuse. Question 177.
While setting up a tray for minor procedure, the medical assistant notices a coworker reaching across the sterile field to get something. The assistant should.
Here are the options. Option A, break down the tray and start over. Option B, report the incident to the provider. Option C, replace the sterile instruments. Option D, cover the tray with a sterile drape.
The correct answer is option A,
break down the tray and start over. Break down the tray and start over is correct because reaching across a sterile field contaminates it.
Question 178. Which of the following represents ventricular diastole on an EKG tracing?
Here are the options. Option A,
P wave.
Option B, QRS complex. Option C,
T wave.
Option D, PR interval.
The correct answer is option C,
T wave. T wave is correct because the T wave represents ventricular repolarization, which precedes ventricular relaxation.
Question 179.
Liver dysfunction primarily affects which of the following pharmacokinetic processes? Here are the options. Option A, absorption. Option B,
distribution.
Option C, metabolism. Option D,
excretion. The correct answer is option C,
metabolism. Metabolism is correct because the liver is the primary organ for drug metabolism.
Question 180. A medical assistant is preparing a capillary collection on a child. Which of the following factors should the assistant consider to determine whether to use the heel stick or finger stick method?
Here are the options. Option A, parents' preference. Option B,
ease of access.
Option C, child's age. Option D, pain tolerance.
The correct answer is option C,
child's age. Child's age is correct because a child's age determines whether a heel stick or finger stick is appropriate.